Vaccination has become one of today's most debated health issues. Some people believe vaccines should be a personal choice, while others argue they must be mandatory to protect public health. This debate centers on two ideas: individual rights over one's own body, and the responsibility to safeguard the community. To understand whether mandatory vaccination is justified, we must consider its scientific, ethical, and social aspects. Scientifically, vaccines are among the most effective tools for preventing infectious diseases. Illnesses such as smallpox, polio, and measles have been controlled or eliminated thanks to vaccination. The World Health Organization reports that vaccines save millions of lives each year. Vaccination also creates herd immunity, which protects vulnerable groups who cannot be vaccinated. But herd immunity only works when enough people get vaccinated. Still, some people oppose mandatory vaccination because they believe it violates personal freedom. They feel forced when vaccination becomes a requirement. However, choosing not to vaccinate can endanger others, especially those with medical conditions. Just like wearing a seatbelt protects more than just the wearer, vaccines protect the whole community. Refusing vaccination can allow diseases to spread and put everyone at risk. The COVID-19 pandemic showed how essential vaccines are during major health crises. Countries with higher vaccination rates reduced severe cases and restored normal activities faster. This proves that vaccination supports not only health, but also economic and social stability. In emergencies, mandatory vaccination may be needed to protect the public. In conclusion, while individual rights matter, public safety cannot rely on personal preference alone. Vaccination is both a scientific necessity and a moral duty to keep society healthy and safe. In conclusion, vaccination is not only a personal health decision but also a responsibility to protect the wider community. While individual rights should be respected, public safety cannot rely on personal preference alone. Scientific evidence shows that vaccines are essential for preventing disease, protecting vulnerable groups, and maintaining social stability. Therefore, mandatory vaccination, especially during health emergencies, can be ethically and socially justified to ensure a healthy, safe, and resilient society.